This is K2 News at 6 on your side.
I want to wake up as many cancer patients as possible to realize there's new ways to fight.
A K2 medical alert, sequence me. Those two words made a world of difference for a local man in the fight for his life. Gene sequencing helped pinpoint what was driving Bryce Olson's specific aggressive cancer and the precision medicine that could stop it. And he wants other cancer patients to know that there is hope beyond traditional cancer treatments.
The thing that woke me up the most, I think I was surfing in Costa Rica, and I don't like to pee in the ocean. It's just too beautiful. I just couldn't hold it anymore.
Bryce Olson didn't know it then, but he had advanced prostate cancer. Like most cancers, prostate cancer has almost no symptoms in its early stages. So by the time he felt bad enough to see a doctor, he was in serious trouble.
And I didn't have just garden variety prostate cancer. I had super aggressive, metastatic, spread to the bones, lymph nodes. You know, my doctors were freaked out about how fast it was growing.
That was 2014. He did the standard of care, surgery, chemo, and radiation, what he calls the cut, burn, poison approach, but it didn't work. The cancer was still there, and it would likely kill him within a couple of years. He wasn't ready for that, and as an Intel employee, Bryce had seen some of the breakthrough work his company was doing with cancer researchers on gene sequencing. So he insisted on sequencing for himself.
So they sequenced the tumor, my DNA of my tumor, and saw that I had hyperactivity in the cell signaling pathway called the PI3K.
Armed with a better understanding of what was fueling his cancer, he entered into the early stages of a drug trial, specifically designed for PI3K.
I got on a trial with that data. I would have never even known to get on the trial, but that data opened up the door. When you have advanced cancer, you need new hope. You need new doors opened for you. And with some of these standard of care drugs like chemo, the carpet bombing, it just kills everything, rapidly dividing. That's why people lose their hair and they get mouth sores, and whereas the targeted stuff just goes after what's driving your cancer, the screwed up mutations that are driving it.
When that trial ended, he turned to Epic Sciences near San Diego. It's developed a blood test, the AR-V7, that can tell patients which prostate cancer therapies are more likely to work. And with his success, Bryce says he feels morally obligated to spread the word about genomic sequencing and his Sequence Me movement, including a website, sequenceme.org, that he's launching this month that will help guide other patients on how to talk to their doctors about this.
I think a lot of the stuff's supply and demand. The moment patients start waking up and demanding it, then the industry has to respond.
The AR-V7 test is now covered by Medicare, making it available to thousands of prostate cancer patients. As for Bryce, tests show no sign of cancer now, heading back to Costa Rica next month to surf and enjoy a life that the odds said would be over by now. You can check out this story at KATU.com for important links to help you talk about gene sequencing with your doctor.